Babare mnongo muri bwatari west kuba utwine ikireki kandi program Omushaho ireberho buri shashatu ndecwika iziciro erikushibwa ishitongore cya National Medical Stores ekitongore kiri kujunanzo bakujanira zembazi mwihanga ryona erizoba anjisha ku bantu reba hanshonga erikumanyanga obstructed labor ninga kushanga ngo mukazi yaza kuzara umwana ati yabasa kushuma kandi obwahati kurigira abukiro misho mirwaro renhango yamba Regional Referral Hospital abakazi gana abakuzara abakazi 10 batunga ekizibechi twine Dr. Paul Karibara hahirwari yamba Regional Referral Hospital chakubantu ganira ahashongeji yochikurebeka ngo agumata yari West Dr. Kato Paul Karibara twakushemera ahatari West kandi shonga yitu no kugamba abwire ubukushanga ngo mukazi yaza umukuzara nalshileba yaza kuzara umwana ati yashuma nashi imwabashaho imukweta obstructed labor inshongeji neha jazamu okututangaraza inshongeji neha umurebo wa Tari West abase kugicenga.
So ensonga ya obstructed labor nikimanyisa nti omwana takushuma baitu mama weye nyinenda ya mama weye inebisa ebikumara okusindika omwana ogu okushuma baitu omwana takushuma. So nyinenda eriyo nesindika omwana nyinenda nigukaje baitu omwana takushuma niyo tukweta obstructed labor.
So doctor inshongeji obwire wingi neba hita kugira ngo omukazi yakasha yo kuzara umwana yagumariye higuru tiyabasa kushuma.
So ekikureta obstructed labor nitukireba okuruga omumihanda nkena obetano. Ekyo ebyo kubanza nibikwataho omwana otukweta passenger, ebikonjeraho nibikwataho passage oba omuhanda nambere omwana akugenda okuraba. Ensonga endijo nekwataho ekitukweta powers oba ekikumanyisa ebisa okureba nyinenda ejo eriyo nesindika omwana ekikumara. Ensonga endijo na etukweta psyche rundi the mind of the woman, how comfortable is she, ejo nayo ina contribution. Then ensonga ekuhendera etukweta another P nekwatana n'omushaho ntukiramu n'okugyeta passive healthcare provider. In other words, omushaho akubashitamire n'omukyara omukuzara ndi akureberera omukazi ogwo omukuzara atakozire ebikwetenjesa okureba nti omwana yashuma yazarwa. So kutandika nebikukwatana n'omwana, sometimes omwana atakushuma habwokuba omwana muhango, omwana abaso kutashuma habwokuba omukwija oba nkokwari omunyinenda tikuri kwa burijo nabaso kuba aresire okugamba side y'omutwe etari ya burijo, nabaso kuba aresire maybe ebegabega, nabaso kuba astami omunyinenda, nabaso kuba abyamira omunyinenda. So aroho ebikukwatana na n'omwana ebikureta omwana okutashuma ezitukweta malpresentations and malpositions. Aroho ebikukwatana n'omuhanda passage, omwana abaso kutashuma habwokuba amagufa g'omukyara ni make. Abakyara ntugamba nti omukyara afunzire omu magufa nuko yahangirwa ati, so nosanga omwana takurabamu. Kandi ekyo nikyo kimwe hari ebyo ebikusingayo munonga okureta obstructed labor. Nobaso kusanga nti nyinenda ine nk'ebizimba, hamuno gwa nyinenda ebitukweta cervical fibroids nibaso kukwatira y'omwana okureba omwana tiyashuma. So hariho ebikwatana na power ekitugamba contractions okusanga nyinenda tina man kare omukyara taine ebisa ebikumara okusindika omwana okushuma. So ekikweta uterine contractions that are inadequate. So nosanga nyinenda maybe because of okusanga nti maybe omukyara atongera infection during the delivery process, okusanga omukyara are dehydrated tanywire oba tarire during the labor process, ndio okusanga nti omukyara abaire mu labor kumara obwire bwingi munonga. So nosanga she has used up all the energy and now nyinenda tekine mani. Then hariho ebikukwatana n'embeera y'omukyara during the labor time, how comfortable she is. Omukusindika omwana, there is a point nambere omukyara aina contributing by pushing or bearing down, ekitukweta expulsion stage. So aho naba netagisa omukyara to push down, but sometimes nosanga omukyara tali settled, maybe because of anxiety, maybe because temukwasiregye, maybe because she's worried, or maybe because there is no someone tari hari omuntu aize nawe omureba wode atahira omureba wode okusitama nawe okuganira nawe okumanyisa nti the labor is going to soon end, or this is a normal process. So the bit about the comfort during labor as well, because you need her cooperation and her input. Then ekindi ekigere nimbazaho ekikwatana na health worker, ekitukweta a passive health care provider atakuyamba omukyara, because sometimes nosanga reba tegenziregye because omushaho ekere n'ebintu ebice byine okukora okureba nti reba egyo yagenda gye. Maybe aine okuyamba okwata enshoha y'amizi okureba omwana yashuma, maybe aine okuteekaho omubazi ogw'okwongyeza ebisa okureba omwana yashuma, maybe aine okuha omukyara omubazi ogw'okutanga okushasha kuri okurumwa okureba nti omukyara yazaara gye.
N'omukazi ki narishi omukazi ari okwe ariyo nakuzaara narishi yagira omukuzaara ninga ari okwe takazire ari ahakabi kokugira ngu naasa kutunga ekizibu eki yaba nazaara.
Noburi omukyara weena, almost buri mukyara weena aina risk ya obstructed labor. Nkokutwaganira that some things are related to the baby. Baitu hariho characteristics of a futures ez'omukyara ezokugamba nti nizongeza chances yokuba aine obstructed labor. Eyokubanza n'okuzaara omukyara atakakuzire. Abakyara bakuzaara bakiri bato, abatukweta teenage pregnancies. Teenage is before 20. So ababo amagufa gabo tigakakuzire oba tigakagarihire kikumara okureba nti omwana yaraba muje. So bari aha risk yokutunga obstructed labor. Abakyara abakuruga abatungire malnutrition, abakyara abatungire malnutrition in childhood, more adolescence and teenage years. So nabo nosanga amagufa gabo tigakuzire kurungi okusindika omwana. Abakyara abaina amagufa make bamukyebire basanga aina amagufa make omukuzaara kwokubanza n'okwongeraho ekyo tikikurugaho nasigara nakyo. So naje okuba ine risk burikire buri kuzaara. Abakyara abagufu abakyara abagufu usually nosanga na ngokuba hangirwe n'amagufa nago arabwo kuba gari make, so nosanga bayina risk yo kutunga obstructed labor. Abakyara abakuzara omu byaro batazarira mu marwaro bayina risk ya obstructed labor habwokuba tibine omushaho omutendeke akubachebero kureba nti omwana size niyejo yo kubaso kusindika omwana aizireje oba kubaho mbazi okwetenjesa nko kwongera ebisa dozi eyekire atari kureta bizibu oba intervention zezo ebintu bingambire bitukora mu labor ward ebikwene bolingo omukyara okuzaraje.
Gwanyuma y'ekyo kubaho kashanga ng'omukazi yazashayo kuzara kunko omwana tiyashuma nikabiki akakubaha mwana kandi nakabi ahakara kubasa kuba aha mukazi gwariyo naza kuzara.
So omukyara yatunga obstructed labor aina bizibu byakubasa okutunga wenko omukyara hariho n'ebizibu by'omwana akubasa okutunga. So katandike n'omwana obstructed labor nyinenda neba neyekwata neba ne contracting neba nesindika omwana baitu omwana takushuma, so neba neteka pressure aha mwana n'aha mutwe gw'omwana baitu omwana takushuma. Esagama blood that is supposed to reach the baby is also reduced, and so the oxygen that is supposed to reach the baby is also reduced during obstructed labor. So omwana nabasa okuruha, omwana okuruha atakazirwe etweta fetal distress omu rujungu, omwana nabasa okuruha, omwana nabasa okufera omu nyinenda atakazirwe, omwana nabasa okuzarwa baitu akazarwa ruhire aketenga oxygeni aketenga kumuteka mu ward y'abana okumarayo obwire. Omwana nabasa okutunga infections okuzarwa akatunga infections yaheza okuzarwa ezikumuletera okwesika obukaba ezikumuletera obuzibu ha bwongo. Omwana nabasa okujwera omu mutwe etweta intracerebral hemorrhage. Omwana nabasa okutunga a number of injuries, nabasa okutunga fractures. Omwana nabasa okutunga ekitweta neonatal jaundice, akazarwa okatekateka arije akatunga okuba yero akafoka wa yero. Ebyo byona bina connection na obstructed labor. Omukazi nabasa okutunga ebizibu ebyaho naho during the labor process, nabasa okutunga n'ebizibu ebindi ebikwizaho kare hamazire okurabaho obwire yaheza okuzara. Ebimwe ebikuba biroho hariyo obwire yatunga obstructed labor nabasa okutunga ruptured uterus okugamba nyinenda okusisikara okwatika. Nabasa okutunga tears munogwa nyinenda okushatuka oba okushatuka omubukazi. Nabasa okutunga okujwa munonga postpartum hemorrhage okujwa munonga yaheza okuzara. Nabasa okutunga infection etweta sepsis after delivery. Nabasa okutunga fistula okugamba okutunga ekizibu kyo kutakontrolling enkari oba okukontrolling obubi. Nabasa okutunga nerve injury okareba takubasa okutambura gye ainamu nka foot drop. Nabasa okutunga separation of the bones amagufa aga pelvis. So nabasa okutunga ebizibu ebyaho n'ebizibu ebikwija omubwire bw'omumisho.
Nicyo kisheme kuba nkikorwa na mnonga okurebeka ngu omukazi yayambwa kuzara gye kandi watunga ekizibu eki yabasa kwerwaho okurebuka ngu we n'omwana we baguma bine amagara marungi. Omukazi
yatunga obstructed antenatal care with a qualified health care provider, with a midwife, a doctor, or an obstetrician gynecologist. Akaguma natunga obujanjabi, akaguma natunga assessment eyokureba nti omwana ariyo nakura gye omukyara ari gye ebizibu ebyaine byona babijanjabire. Then bakakora delivery plan and preparation, tugyeta birth preparedness and complication readiness plan. Nuko omukyara namanya ninja okuzaara omwirwaro riti, ninja okuzazibwa abantu bati, ninja okwetenga okuba n'ebintu ebyo n'ebyo eby'omwana n'eby'omukyara. Ninja okwetenga okuba n'omuntu w'okuba ali present during the labor, a labor companion. Then akagenda omwirwaro ahabwire bayikiraniize nawe n'aba doctor n'aba midwives bagamba ahabwire bwareba yatandika ije omwirwaro bakamonitoringa bakamukorera ebikwetengesa okureba yazaara gye. So hariho contribution ey'okugamba nti omukyaro ogu ayina okuraba mu antenatal care. The community, what they can do, the community can support. For example, the relatives can support the woman or her community in encouraging the women to go for antenatal care, in accompanying the woman for antenatal care, in taking care of her home when she is having an antenatal care visit. But also okugenda nawo omwirwaro obwire bw'okuzaara bwahika. Then omwirwaro, what we can do first to prevent but also to treat and to identify. So ekyokubanza ekitukwasa okukora omwirwaro is to make the hospital environment welcoming and responsive to the women's problems, such that they can come back with subsequent deliveries. Twabakira gye, making sure labor ward is friendly, at the same time achieving the objective of a safe delivery. Ekyakabiri, that is an organizational input omwirwaro. Ekyakabiri, okureba labor and care during the delivery is respectful. That is important. Ekindi, okureba labor is monitored. Okureba omukyara tiyeje omwirwaro and she's neglected but she is monitored. Bamukyebera gye ahabwire. Bamumanyisa ebikugenda omu maisho. Atari okumukyebera okandika omu fayiro akagenda ataine ekyamanyire. Wamukyebera wamushoborra ekikugenda omu maisho, omwana ayemerire ata, labor eyemerire eta, ebintu nk'ebi. And then making timely decisions. Okureba twamukyebera, twakora record, and we have interpreted the monitoring tools. And then we make a decision, a timely decision. Omukyara naje okuzaara gye. Should we give her more time? Should we be patient with her? Is the baby okay? Oba omukyara nayetenga okushemezibwa. So early identification through monitoring and timely interventions. At the end of it all, omukyara wakuba ine obstructed labor nabaasa okwetenga interventions that are operative or interventions that are not operative. The way we said, causes the obstructed labor, they differ. If usually the biggest problem we have said is that the bones are narrow, the baby is big. And most of those ones require an operation. The mother is prepared for an operation, a cesarean section, to deliver the baby. Through cutting on the abdomen, ahibondo ly'omukyara, and then we cut through the uterus, we deliver the baby, we repair the uterus and repair the abdomen, ibondo ly'omukyara. Usually for that. But there are other causes of obstructed labor is tubaire tuganireho. Nobaasa okusanga oruhago rubaire rwijwire munonga enkari, omukyara atakushesha during the labor. And the intervention can be as simple as okuteekamu akapiira, orinde okuha omukazi privacy, and you talk to her, akasesha, and the baby is delivered. Sometimes nosanga ebisa is not sufficient, the contractions are not sufficient. And the solution can be as simple as monitor the woman. If contractions are not okay, put up medicine that can increase contractions in the right doses and monitor her, and she delivers. Sometimes it can be that all that we need is to provide an enabling environment. If the woman needs to bear down, talk to her gently, control her pain, put her in a normal position of delivery that is comfortable or that she wishes to deliver in, and she delivers. So not every obstructed labor really implies that the woman will end up with a C-section. But majority of the time, the problem of obstructed labor leads to cesarean section. So cesarean section is one of the medicines for obstructed labor, or one of the ways of treating obstructed labor.
Nonga turukhendera Dr. Waawe abachara kwitebekanza kuzara hamwe n'abashaho okwashime kwana betwaza na mnonga umbwire w'abachara baba baza kuzara binenda.
So abachara binenda reka tutandike nabo nti obstructed labor are common, and it's one of the leading causes of abachara okufera omukuzara. Ina complications nyingi munonga, but obstructed labor nebaasa okuba prevented, detected early, and treated. The important things ebyomukyara oinenda ebyokukora is to attend antenatal care ahabwire and finish all the 8 or even more antenatal care visits ezikwetenga, and going to a hospital or a health center that is equipped and ready to conduct safe deliveries. Health center 3, 4 district hospitals and regional referral hospitals. And to the doctors, chairman mnonga Omushaho ninteekateka n'okuha package ya antenatal dokukebera abakyara abatakaziire okureba nti twaba antenatal care eyeri adequate rundi enyakwikire, and making okukora plan n'omukyara okukora plan ey'okwija okuzaara omu irwariro. Then ahirwariro okureba nti obujanjabi obutukuha nti nibusigaza nibuha omukazi ekitiinisa, respectful. That's what I want to mean. Respectful care during delivery. Baitu no, in that respectful care okureba nti we are monitoring labor using runitukozesa ebyokukozesa ebya Ministry of Health ebyeteekireho labor care guide okureba ziri field okureba ebitukora byona bihandikirwe, and we are making decisions at the right time.
Inksima mnonga iwabutireho program y'ejo Omushaho wawe kurugaye twatandishira kandi ubuhati tirion sibura konka kampa miyengo chukuru mnonga wagecho shime kuba nokora omukazi tayirwaro wame kutungenda kugira ngo base kureba na mnonga mpaka ozire kandi kubasa kwicinjira okufunikiza ubwecho wakufuna no kurebeka ngo yahika abashaho abashikirire ukubasa kuba nabamuhera akabasa kuzara kurunji na umwana kandi no kuratara abashaho obutosha. Program Omushaho wawe nokishowaho ekitongore cya National Medical Stores ekirugujinanzwa kujanjaza imbazi omwihango ikize tukusiburaha warare kurunji. Program Omushaho wawe yabane kushibwaho National Medical Stores.